Hi, I'm Jennifer Hinke, the laboratory manager here at the Coachella Valley Mosquito and Vector Control District. And this video is an explanation of our invasive mosquito management program and arbovirus response plan. Aedes aegypti and Aedes albopictus can transmit dengue virus. Mosquitoes pick up the virus from infected people, and after some time, they can transmit the virus to a new person when they bite. Zika, chikungunya, and yellow fever viruses have very similar cycles. At this time, we have not had any transmission of dengue or Zika virus in the Coachella Valley. But because Aedes aegypti mosquitoes are here, it is possible that we could have transmission in the future. The district conducts its work using an integrated vector management program. This means that the district uses a science-based approach to control mosquitoes and other vectors. We conduct surveillance to determine when and where mosquitoes and viruses are present. We educate residents and property owners on how to reduce mosquitoes where they live, work, and play. When the conditions are right that control is needed, we use physical control by removing standing water where mosquito larvae live. And we use chemical control, using the appropriate control products, targeting mosquitoes where they live and are active. The district reviews the California guidance for surveillance of and response to invasive Aedes mosquitoes and dengue, chikungunya, and Zika in California, produced by the California Department of Public Health. Our invasive mosquito management program and arbovirus response plan adapts this information to be specific to the needs of the Coachella Valley. Our plan outlines how we carry out the surveillance for mosquitoes and the viruses they can transmit, what control options are available to us and what we use, how we communicate the risk, and how we coordinate our work with other agencies involved. When someone is sick with dengue, their medical provider informs the Riverside County Public Health Department. Riverside Public Health shares with us where the person lives, as well as other information that will help us reduce the risk of transmission to other people. The Surveillance and Quality Control Department sets extra traps in the area to find out the abundance or number of mosquitoes and sends those mosquito samples for testing. We check the efficacy of the products we will use to control adult mosquitoes so that the operations team can use the most effective ones. In operations, vector control technicians use our internal system to see known mosquito habitats that need to be checked. They post mosquito activity signs at intersections and entrances to communities. They conduct inspections in the areas, looking to get into people's yards to look for mosquitoes. They also look for areas of non-flowering plants where an application can be made to target mosquitoes that rest on those plants. Our public outreach department increases their communication to the community, targeting the same areas. They spend time reaching out to you and educating leaders and residents in those neighborhoods. Once we have additional information on the abundance or number of mosquitoes from our traps and our inspections, we may make additional responses. Typically, these are in the forms of adult and larval mosquito control activities. Applications of adult mosquito control products are made in the evening or in the morning before sunrise, while applications for larval mosquitoes may be made at any time of day. We make these by truck and by helicopter, depending on how much virus activity and mosquito activity is in the area. We also reach out to city, county, and community leaders directly to spread the word on how to help us reduce the mosquito population and how to prevent people from being bitten by mosquitoes. Public outreach shares this information by press releases, resulting in TV, radio, and newspaper stories. As we complete this work, behind the scenes, the district managers will also be having discussions with county, state, and other mosquito control districts to coordinate efforts. We have ongoing discussions with our vendors to ensure that we have supplies that can be replenished. We partner with the county to ensure that the medical community, that is our doctors, nurses, nurse practitioners, and others, recognize the symptoms of these viruses so that patients can be tested quickly. There are steps that all of us can take in order to ensure that we reduce the risk of transmission of these diseases in our community. One is to communicate with our elected officials and representatives on the importance of public health funding. And this is not just for the Coachella Valley Mosquito and Vector Control District, but also for the Centers of Disease Control, for the California Department of Public Health, and for the Riverside County Department of Public Health. We all can be proactive in protecting ourselves from mosquito and insect bites by wearing appropriate repellent and limiting our activity in places when we know mosquitoes are being active. This is both when we are here in the Coachella Valley, but also when we travel other places that we should be wearing repellent to ensure that we're protecting ourselves from bites. And finally, we can also share this information that we now know with our friends and neighbors so that we can protect them as well. Thank you for viewing this video. If you have questions or if you need service for mosquitoes or other vectors, please reach out to us by phone or by email. Thank you.